everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to review how to complete a CLIA certification application and submit the application. If you did not watch the first part of this two-part series, I encourage you to stop the video now, go watch that one, and then resume this one after. It will make a lot more sense and help you in this process. All right, so let's go to the application itself. Here is the CLIA application for any of the levels of certification that you will be applying for. You will see it's issued from the Department of Health and Human Services for Medicare and Medicaid, so CMS. Down in the bottom left-hand corner, you can see it is the form CMS 116. You will see that referenced on the CMS page that we reviewed in the last video. And you can see the date of issuance for this application. So March of 2024, it's the most up to date because I clicked the link from that page in our previous video and it brought me here to this fillable form. This is way nicer than it used to be because you used to have to print the form, fill it out by hand, and then send it in. But now, because of technology, we're able to click the hyperlink. It opens in your browser with a fillable page. So you can see you just want to work from top to bottom, left to right, and fill out everything. The first 5 pages over here on the left are fillable forms, and then pages 6 through 10 are instructions and information that you need, okay? So if this is the first time you're applying for a CLIA at a specific location, like maybe you have a CLIA existing already at one location, but you've added another location, or you have another location that you're now going to be performing laboratory tests and you need to apply, then you would select initial application and what start date. If it's going to be something else, like you need to change your certificate type, like you were CLIA waiver, and then you have to add the PPM or something like that, then you would come in here. It is especially important that if you have a change in laboratory director, that you also submit those changes. If you have an already existing CLIA ID number because you're changing something or you're renewing or whatever, then you would need to make sure that you put your CLIA identification number here so they can find you in their system. The D in the ID is very important because that is indicating that it was CLIA approved. You would put the facility name, the TIN or EIN number here. Whatever email address should be on file to get updates and things to be emailed to regarding the CLIA. So maybe an admin address instead of a specific person's email address is always recommended. So if something were to happen to the person who monitors this email, maybe they get sick, they're out for an undetermined amount of time, they lose their job, they quit, whatever, then someone else who takes over and has access to like a group email address would be able to see it. Telephone number, fax number, very self-explanatory. And you'll want to see that the physical location of the laboratory, so you have to make sure that you put all the details, including the building, the floor, the suite, if applicable. And they tell you that this is the address where the coupon fee, where they charge you how much you owe, and the certificate being issued will be mailed to this address unless mailing or corporate address is specified, okay? So you just have to make sure you read all these instructions and they tell you what to do. Come down here, you can see send fee coupon to this address, physical, mailing, or corporate. Same with send certificate to this address, physical, mailing, or corporate. Okay, so you just have to read everything. Name of the director, your laboratory director's phone number, and their credentials. Down here, which type of certificate are you requesting? We reviewed the different types in the previous video. However, there are other instructions attached to here that will help you. You can use ChatGPT to help you. You can use that FDA website to look up the tests that you're going to be running to see what those classify as to be able to help you. So if you're just doing point of care testing and nothing more complex, you would choose that certificate of waiver right here, and it tells you which sections to complete if you're choosing this option. If it doesn't have a section listed, then you can skip it. Here's a note. Laboratory directors performing non-wave testing, including PPM, must meet specific education, training, and experience under Subpart M of the CLIA regulations. Proof of these qualifications of the laboratory director must be submitted with this application. Okay. Certificate for provider performed microscopy procedures, the PPM. These are the sections you would complete. Certificate of compliance, these sections. Certificate of accreditation, these, and indicate which of the following organizations your laboratory is accredited by for CLIA purposes for which you have applied for accreditation for CLIA. Okay. Is it JCO, CAP, ACHC, COLA, ASHE? You would know. If that's applicable to you, you would definitely know this. If you're applying for a certificate accreditation, you must provide evidence of accreditation for your laboratory by an approved accreditation organization as listed above for CLIA purposes, or evidence of application for such accreditation within 11 months after receipt of your certification of registration. If you remember from our previous video, the certificate of registration is kind of your bridge or your holding time so that you can get recognized by an accredited agency. And so you have to make sure that you are following all of these guidelines. Then down here, you have to explain what type of laboratory you are. So check the most descriptive of facility type. You have ambulance, ambulatory surgical center, or ASC, ancillary testing site in a healthcare facility, assisted living, blood bank, community clinic. I know you can read, I don't have to go through all of these. And you just kind of go and find what is the best. Most people watching this, I'm guessing, are going to choose physician office, right? You will want to make sure that you are explaining to them exactly where these tests are going to be run. If you don't see something that actually applies to your specific lab, then you can do an other and explain it here. You have to give them the hours of laboratory testing. If you're going to be doing it 24/7, then you can just click this box and you don't have to complete all of this. If it's only during business hours, you do have to complete it. If Sunday and Saturday you're not working, I would put NA. I would not leave it blank. Just like a credentialing application, it's not good to leave blank areas in a section in which you are required to fill out based off of the different sections you're told to complete above. If you have multiple sites, it must meet one of the regulatory exceptions to apply for this provision in 1 through 3. Are you applying for a single site CLIA certificate to cover multiple testing locations? No. If no, go to section 6. Yes. If yes, complete the remainder of this section. Indicate which of the following regulatory exception applies to your facility operations. So you can say, it's not a fixed location. You can say it's a not-for-profit. So those are kind of your exceptions of how you can get one certificate to cover multiple locations. I know I said in my previous video you can't do that. However, you can, but you have to fit in these guidelines in order to be able to qualify for that. If not, then each location needs to have their own. Okay? Here's the name and address of the locations and the tests performed in those locations. Down here, waived testing. So this is for your CLIA waiver. If only applying for a certificate of waiver, so you're only doing those point of care tests that do not require any higher certification from CLIA, you complete this section and skip section 7, which is the PPM testing, and 8 for non-waived testing. Okay, so you have to be able to list all of the tests that you're going to be performing for point of care for waived tests, what the analyte is, the test name, and the manufacturer. You should be able to find this information from your manufacturer. Like I've gone on McKesson and looked this up for the test that I ordered. You can ask your representative from McKesson or from the manufacturer itself to help you with this information. I'm sure ChatGPT can probably give you this information now because that wasn't around back then when I had to fill this out. If you need another piece of paper, you do need to attach it, and you do the best you can, okay? And then you have to indicate the estimated total annual test volume. It's an estimate. Obviously, if you're just opening or you're just starting, you're just going to do the best you can on how much you think you're going to do, okay? And then you need to check here if no wave tests are performed. If additional space is needed, click this box and attach additional information using the same format. So I would open an Excel sheet, I would label the 3 columns, and I would just continue it, okay? If you're doing PPM testing and you're only applying for a certificate of PPM, then you would complete this and you would just keep going. So you can see the different PPM tests that are qualified under this certification. You have direct wet mount preparations, potassium hydroxide for the KOH, pinworm, fern tests, post-coital direct qualitative exams of vaginal or cervical mucus, urine sediment, nasal smears, fecal leukocytes, and qualitative semen analysis. Okay. So you just go through this. Now, if you're doing non-wave tests, if you need a higher level of certification, that's where you're going to list your other tests here. You can see it's almost the same exact format. They just need a little bit more information. And you can see use M for moderate complexity and H for high complexity. Again, you're going to get this from the manufacturer or from someone that is able to give this information based off the test that you perform. Again, if you need additional space, check this box and submit it. You just want to go through this and fill it out the best you can. Again, I've never done anything higher than a CLIA waiver and PPM, so I've actually never done non-wave testing applications, but it's pretty self-explanatory. If you come down here, you're going to go through even more. We're almost done. This is the last page that needs to be completed. If the director of the laboratory serves as a director for additional laboratories that are separately certified, please complete the following. So you would put that here. You would print the name of the director of the laboratory. You would print the name of the owner of the laboratory if they're different. Sometimes they could be the same person, a lot of times probably. And then they actually have to sign it. Sign in ink or use a secure electronic signature. So you could do it by like DocuSign or Adobe Signature as long as it puts that certification of day and time of the actual signature on there. Other than that, they would have to do a wet signature. Okay. And then see here, completed 116 applications, which that is the form that we're using that we went over in the beginning, must be sent to your local state agency. So it's processed by your local state agency, even though it's a federal form. Do not send any payment with your completed application. And then here is the link for state agency contact information. You can click it here and it will take you to it. Here is that information. You would look it up by state or by territory if you're not in the contiguous United States or part of the 50 states like Hawaii and Alaska. You can see America Samoa is on here. I know Puerto Rico is on here. And they have hyperlinks so you can email them directly and attach that application. I can tell you that I have personally reached out to our local contact in Oregon in the past because I was a little confused filling out that application myself the first time, and they were super helpful and very responsive. So hopefully you would have the same experience. If you have any questions or you get stuck anywhere, use them as a resource. You have phone numbers, you have emails. Definitely don't let that go to waste. So if you go down here, it's all in alphabetical order. You will see District of Columbia in Washington, D.C. Virginia has its own for that jurisdiction. Here's Guam, Idaho, Illinois, and you just go down and you can find whatever state that you're in and find that contact information. So once you complete that application, I encourage you to save a copy of it, of course, before you email it, and then you will email it. Once they receive it, they will be in contact with you and they'll either email you how much you need to pay or they'll mail it to you in the mail or email. I did read something that by March of 2026, they're trying to go paperless. So it looks like as of March of 2026, all the communication that they would be sending back to you in the mail, like the fee that you have to pay and the actual certificate itself, they're no longer going to be mailing it. They are going to send it all through email and electronic means. So just be mindful of that. But as of right now, which is October of 2025, you'll probably receive that invoice in the paper mail, and you can pay it online. Once you pay it, they'll issue you your actual certificate. The certificate does need to be hung in your laboratory. I always make a copy of it and keep it in my master files, or scan it and keep it saved on my computer in my important documents folder, so that if something were to happen, at least I can reference it. I also make sure that I send it to all of my insurance companies. That's the other thing a lot of people forget to do, that last step. You need to go on to PICOS, CAQH for your location. You need to send it to your insurances, that certificate, whatever it is waiver or whatever level you have, because then they need to put it on file. So when you send claims with labs that you're billing out that require a CLIA ID, it's on the claim. It matches what they have in the system under that location where it's being serviced for that lab test, and everything should be good. So you can see all this contact information, even has websites that you can check out, because, like I mentioned in my last video, different states might have additional requirements for laboratories. So that would be a great place to go if there is a website to check it out. If not, go to your local Department of Health and Human Services state website to see if there's any additional lab requirements. Okay, so complete the application, email it to your local state, wait for you to receive an invoice to pay whatever amount is required based off the level of certification that you're applying for. Once you pay it, you'll get that certificate. You'll hang that certificate in your office, make a copy of it, scan it, whatever you need to do, and make sure you're sending it to your payers and updating both your CAQH for your location and PICOS with all of that information, so that when claims go over, it matches your profile in the payer system and you will be good to go. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit from this instruction. Thank you so much for the support, and we will see you next time. Bye-bye.